Thank you. It's an honor to be here with you. I wish we could be together in person, but I'm still so excited to be with all of you virtually. Congratulations to the Women's Center for celebrating your 20th anniversary. What an amazing accomplishment. That's 20 years of supporting women, supporting our community, and supporting a brighter tomorrow for all of our girls. It is through your work that so many women have found hope, and that hope has turned into action. In the craziness of our lives today, I hope you take a moment to pause and celebrate the multiplicative impact you have had on the trajectory of so many. This year, we also reflect on another major milestone for women, the 100th anniversary of the passage of the 19th Amendment, the law that gave some women, not all women, the right to vote. Women back then knew that voting equals power, just like we know that today. We've come a long way in regards to women's issues and women's equality, especially here in Michigan. And we should also celebrate the incredible moment that we're in right now in our state with women in so many leadership positions, from our governor, our attorney general, the U.S. Senator, Secretary of State, State Chief Justice, and more. More women are in our state legislature in Michigan, and we sent more women to Congress. Finally, girls all over the state can look in the mirror and see themselves as leaders and also as scientists, as engineers, as writers, as doctors, as whatever they want to be. Representation matters. We still have a lot of work to do, a lot more glass ceilings to break and more doors to bust open, from pay parity to reproductive rights. But the future is certainly brighter, at least here for our Michigan girls. And a lot of that is thanks to you and your work. And before we can talk about the future we hope to leave for our girls and our granddaughters, I want to reflect on two historical Michigan and Flint connected women who played an incredibly influential role in my work like a century ago. So I recently wrote a book, and it's very much a memoir, and it was such a reflective process for me. And I used it as an opportunity to pay tribute to so many giant women that I have been lucky to stand on the shoulders of, from my mom and my grandmothers to countless women teachers and colleagues that I have been fortunate to work with. Many folks that I was able to walk with, and so many that actually walked before my time. And one of those women I want to talk about today and pay tribute to, who kind of paved the way for me in my work, is a woman named Alice Hamilton. She graduated medical school at University of Michigan in 1893. She then went on to Chicago, where she lived at the Hull House, and she worked with Jane Addams to provide patient care and wraparound services to recent immigrants and poor people. And it was there, where she was practicing as a physician, that she realized, hey, so many people that are coming in to see me are actually sick because of something that they're exposed to on their jobs. She quickly became a national expert in the field of occupational health and occupational medicine. She was the very first woman professor in Harvard in 1919. She suffered from so much sexism and harassment. At one point, somebody said, in quotes, "But who will darn the stockings if women are going to be bacteriologists?" She persisted. And something I admire the most about her is that in the 1920s is when General Motors wanted to put lead in gasoline. They said that there was no other option besides putting lead in gasoline to fix the sound that cars made, engine knocking when fuel and air mixed. And there were alternatives. And even a century ago, she knew, and the world knew, that lead was a poison. And she went after that industry with all her might, often the only woman in the room. And she suffered quite a bit from her work and her perseverance as she was continued to fight for the most vulnerable, especially children who were going to suffer from this public health disaster. So she's definitely one of my heroes. Because of her, we know so much about lead poisoning, but we also know how hard it is for women to speak up and to fight against really powerful forces, which are often men. Another one of my women heroes that I want to talk about, who also paved the way for me, is a woman named Janora Dollinger Johnson. And she had a big role to play in Flint's history. So you guys obviously know about Flint now with our water crisis. And I think for so many people, when you think of Flint, you think of like brown water. But Flint didn't always equate to disaster. Before the water crisis decades ago, Flint was really famous for being the birthplace of cars, the birthplace of General Motors. But even more than that, Flint was the birthplace of the American dream. The birthplace of the middle class. And that happened because of some really brave auto workers who did something totally illegal and totally radical, where they went on strike and they kind of shut down all the car factories, and they went on strike for 44 days. And finally, they were recognized, their union was recognized, the UAW that was born. And what happened afterwards really heralded the beginning of the middle class, the beginning of living wages and benefits and pensions and all these things that we take for granted. So we hear a lot about the strikers, but really critical to those strikers was a woman named Janora Dollinger Johnson, who was a spouse of one of the strikers. But she wasn't just a spouse. She was a critical organizer, strategist. She helped devise a lot of the action that happened. So she is one of my heroes. She went on and for the rest of her life fought for human rights issues, labor rights, civil rights issues. She went on to lead the ACLU of Michigan back in the mid 1900s. So definitely, absolutely one of my heroes, a brave young woman who saw that we could make the world a better place. So Alice and Janora are a couple of my heroes. There's so much more to learn about them, but I wanted to kind of share their stories. They were both brave. They went up against powerful people, especially men. And despite all the obstacles, they never lost hope. Their work wasn't selflessly about themselves. It was about others, and especially the most vulnerable among us. It was about small children being poisoned, and it was about workers who were demanding living wages. They channeled their hope for a better tomorrow into action. And because of their vision and persistence, they made the world a better place. I've often thought about Alice and Janora during my work in Flint. I had moments when I was scared, where people told me I was wrong. I had moments where I was being dismissed and discredited, moments where I felt tiny and defeated, where I even began to second guess myself. And it was during those moments that I thought about Alice and Janora and the generations of women that have been silenced and belittled and undervalued. And I also thought about my girls, not only my two daughters, but also of all the Flint kids that I am privileged to care for. They kept me grounded and inspired me to persist. As a pediatrician, my job is very much to make sure kids are healthy today, but more importantly, it is my job to make sure that they have the brightest future possible. In some ways, I'm in the business of dreams and making the dreams of our kids come true. However, my kids in Flint, similar to kids in so many places, wake up to nightmares, wake up to situations that poison their potential. In Flint, it was poisoned water, but elsewhere it's poverty and poor schools, unemployment, racism, patriarchy, violence, and the list goes on. Systemic conditions that rob our children, especially our girls, of their dreams. And my story in Flint is a story of what happens when the very people responsible for keeping us safe and healthy care more about money and power than they do about us or our children. But I also want to share with you that my story is also a playbook of resistance and hope. And that is a story that we all need right now. So when I first heard about the possibility of lead in our water in Flint, there was no going back for me. I knew that lead was bad. I respected the science that has got us to understanding even what Alice Hamilton told us a century ago, that it was a poison, to now recognizing that there was no safe level. I knew that if there was lead in the water, that was threatening the tomorrows of all of our children, all of their dreams. So I did something that doctors aren't really supposed to do. I walked out of my clinic with my white coat on, and I stood up at a press conference with the science, the research that our children were being poisoned by our untreated corrosive water. And I was scared. I thought people could hear my heart pounding on the microphone. And just like everyone else in the Flint story, moms and pastors and journalists and scientists, I was attacked, dismissed, discredited. The state said I was wrong, unfortunate, and even hysterical. It took a while, but finally our persistence, our science, our teamwork spoke truth to power and helped expose that preventable public health crisis. So Flint is so much a story of science denied, but it was our science that spoke truth to power. And today we are leaning on incredible science, the science of brain development and trauma and resilience in our recovery. And sometimes I say I'm writing actual prescriptions for hope, but our prescriptions for hope are not just words. They're real, tangible things. They are actions. We have built so many programs based on the evidence of what helps families and children. Home visiting programs, high quality childcare, Head Start, preschool, Medicaid expansion, parenting support, trauma-informed care, school health services. And we're also working on the bigger things that families need, like living wage jobs, poverty mitigation, economic development, participatory democracy, restorative and environmental justice, and self-determination. And that gets to my favorite part of the story, how we can all once again learn from Flint. So you think of Flint as a story of a crime committed with absolute indifference against some of the most vulnerable people in our country. But what I want to share with you is that it's also a story of how everyday people, majority women, moms and pastors and activists and journalists and students and scientists and doctors, bravely resisted and said, "We've had enough," and took action. It's about refusing to accept the status quo. It's about our responsibility to stay vigilant. It's about taking action for what is right, even when it's hard, even when it's scary, even when it may seem impossible. It's about turning a crisis into resistance, into hope, and it's about turning that hope into action. That is what I learned from Alice Hamilton and Janora Dollinger Johnson. That's what they taught me. And it's also what my kids in Flint inspire me to do every day. So as we reflect on our past, celebrate how far we have come, let us always stay grounded in our kids, especially our girls, as we continue to work together everywhere to build a better tomorrow. A place where eyes stay open, where people stand up for what is right, where the strong and powerful voices of women are heard and respected, where we care for each other, and where democracy and equality and opportunity are once again encouraged and advanced. Our kids, our girls are counting on you. And remember, the Women's Center has been doing this work for 20 years now, the seemingly impossible work of turning hope into action. Congratulations, and thank you.